According to the Centers for Disease Control risk factors, President Trump is at increased risk for severe illness from coronavirus. 8 out of 10 coronavirus-related deaths in the United States have been among adults aged 65 and older. The First Lady, who also tested positive, is statistically less likely to end up with severe illness. News Channel 3 Shelby Nelson live now with more on the difficulties that the president may face. Shelby.
Well, John, a treatment process is well underway for the president, the White House saying that he's received what is called an antibody cocktail and he's now hospitalized and will be there for the next 2 to 3 days. Now, I spoke with a local health expert today to see what other risks he could be facing.
President Trump touching down at Walter Reed National Military Medical Center in Maryland. That's after the shocking revelation both he and First Lady Melania Trump tested positive for COVID-19, a virus that's already infected more than 7 million people nationwide.
I think I'm doing very well, but we're going to make sure that things work out.
The president releasing a statement on his condition, and though he appears to be okay, his doctor said he was feeling fatigued. Many questions now arising about the health risks the president could face, such as his age and weight.
Anytime somebody who's in an older age category gets COVID, they're at much more risk for serious consequences from it.
Eisenhower Health infection preventionist Michael Connor says as we get older, our immune systems tend to weaken.
Statistically, a person in the greater than 65 to 74 age range that he would fall into is approximately 5 times more likely to wind up in the hospital when they have COVID. So he is at higher risk for hospitalization and higher risk for mortality.
That's compared to people ages 18 to 29. The death rate compared to infection rate still remains low. Groups that also have comorbidities like diabetes and cancer can be at greater risk. In President Trump's most recent physical exam, his weight could also be an issue because it classifies him as clinically obese.
He's just a little bit over the limits, so between that and the medical care that he's receiving, I'm very optimistic that he'll have a recovery.
The president will now spend the next few days hospitalized at the same hospital he visited back in July, with a rare appearance of him wearing a mask. Throughout the course of coronavirus, he's been skeptical about the effectiveness of wearing them, something most health experts disagree with, to help prevent the spread of the virus.
Truly, the public health community has always said that masking is what's indicated.